My name is Frans Germany. I'm a plastic and reconstructive surgeon in South Africa, and I have no financial interest in any product shown in this video. In 1988, during my registrar years, I observed a simple phenomenon in the behavior of scars in my patients. I noticed that scars thickened in response to forces that were applied to them. Here is an example of just such a response. This teenage boy had undergone cardiac surgery. As you can see, his scar healed in two different ways. In the upper chest and in the upper abdomen, below the end of the sternum, also known as the breastbone, the scar healed as a thick pink ridge. At the level of the lower end of the sternum, the scar was narrower, flatter, and paler. Now look at what happens when I breathe, once I've hooked my thumbs over the sides of my chest and joined my fingertips in the midline. Watch my fingertips. When I inhale, they separate, and when I exhale, they touch again. They do this in the upper chest, and they do the same in the upper abdomen. But at the level of the lower end of the sternum, they don't separate with inhalation. Look at the scar again. I'm sure you can see that wherever distracting forces were applied, the scar thickened and remained active. Where there were no distracting forces, the scar reacted much less. Imagine what would have happened if from the very beginning we had provided support for the scar, support that would prevent it from feeling and the applied stresses. The formation of a scar is a normal response to any injury that penetrates the full thickness of the skin. Scarring in response to an injury is common to all complex living things. Even plants develop scars. There are, however, very few creatures other than man and members of the horse family that develop excessive scarring. Scarring happens not only in the skin, but in all tissues such as muscles, tendons, bones, and soft organs. On the other side of the coin, there are vertebrates like amphibians that have scarless healing. This is called regenerative healing. This form of healing is even able to produce new limbs to replace those that have been lost in an injury. Keloid scars are scars that overgrow their own boundaries, become bigger and bigger in an uncontrolled way, somewhat like tumors. They can become painful, itchy, and unsightly. These features of scarring are usually very difficult to control. This unpredictability makes scarification less popular than other forms of bodily decoration. Much research has been conducted over many years to determine the factors that influence scarring. We have gained deeper and deeper understanding of all the most minute biochemical effect feedback systems, signaling loops, and genetic influences that affect the ways in which scars form. We have learned interesting things, such as the fact that a mammalian embryo injured in the uterus will heal without any trace of a scar. This amazing fact could lead to the scarless correction of conditions such as cleft lips and palates if and when the ways can be found to routinely and safely perform the surgery while the baby is still in the womb. Mechanobiology is an emerging field in science. It became firmly established in about 2010 when the Mechanobiology Institute of the University of Singapore was established. It explores the response of cells and tissues to mechanical forces. The Mechanobiology Institute of Singapore has a large research team. In several studies conducted there and in other university departments are beginning to unravel and explain the phenomena that we have observed. Judging by their work, it seems to be a dynamic organization that provides a stimulating environment. Here are some clips from their website. The second clip shows how the nucleus of a normal cell can move around within the cell, but how it is trapped and held in a fixed position when the cell is stretched. This, of course, will affect many of the functions of the nucleus and may lead to unusual or unexpected responses. A free-moving nucleus making contact with other cytoplasmic organelles such as mitochondria, Golgi apparatus, ribosomes may elicit different genetic signaling to that issued by a stretch-strapped nucleus. We already know that primitive signaling systems play an important part in scar formation. Systems such as WNT signaling, which determines whether a fruit fly develops wings or remains wingless, are involved in the control of human scars. The genetic material, DNA, in the nuclei of our cells orchestrates the release and response of these messages by the cell. Among these messaging substances are the cytokines. Cyto means cell, and kine means movement. Think of kinetic energy or telekinesis. So cytokines are messages which are cell movers. The most important cells that are called into the wound by the cytokines are the fibroblasts. They have many functions that help to close and strengthen the damaged area. The fibroblasts produce hyaluronic acid molecules, collagen fibers, and elastin fibers. These are all building blocks of the extracellular matrix. They also produce growth factors to stimulate the growth of other cells such as keratinocytes. They are very busy cells, also producing enzymes that facilitate chemical reactions in the interstitium. They are the main connective tissue cells in vertebrates. One can understand how forces that distort them can change their function by stopping or limiting normal interactions of the nucleus with other cytoplasmic organelles. There have been hundreds or even thousands of erudite peer-reviewed published papers on the tissue reactions, biochemistry, and cellular functions involved in the scarring process. But it has, in my opinion, only been since the advent of mechanobiology that we have begun to understand the practical issues in scarring. Please don't misunderstand me. We have much to learn and much to gain from the knowledge of scarring biochemistry. But there are at this time very few applications of that knowledge that will help me as a surgeon to help my patients get better scars. Hoda Zarkoub, in her PhD dissertation, showed that keratinocytes grew in a more organized and less proliferative way on firm acrylamide gel substrates when compared to those growing on softer, more pliable gels. To me, this much simplified indicates that if you can stiffen the area of wound healing, the scarring will be more organized. Rei Ogawa from the Nippon Medical School in Tokyo is arguably the current world expert in the mechanobiology of scarring. He is the chief and professor of plastic and reconstructive surgery, and his work has shown that the internal extracellular fluid forces as well as the extrinsic forces affect the quality of scarring. How these forces influence calcium ion channels in the active cells, how some aspects of the scarring are influenced by neuropeptides released from sensory nerve endings after extrinsic forces are detected, and how these messages are relayed via dorsal nerve root ganglia. How normal extrinsic forces lead to normal maturation of scarring, while strong extrinsic forces lead to hypertrophic scarring. The diagrams shown here are taken directly from his paper, Mechanobiology of Scarring. We have used them with the express permission of the author. There are many questions about scarring that I would like to see answered in my lifetime. Is it the elastic support of the uterus that plays a major role in the absence of fetal scarring? We know that the fetus has unmyelinated nerve fibers until a few days after birth. We also know that frogs have a mixture of myelinated and unmyelinated nerve fibers throughout their lives. So does the absence of myelination of nerve fibers play a part in the regenerative healing, possibly due to alteration of neuropeptide release responses? Are there biochemical factors in the intrauterine liquor that play a part in scarless healing.
If there are such substances, what are they, and can we use them on our scars?
The answers may change our future management, but for now we need a plan that is practical and that can work well. These are the practical facts that we currently have at our disposal. What we need is a simple and comfortable way to support a scar in such a way that the patient can carry on with normal life, normal activities, and mostly forget about the need to look after the scar. There are many tools already available, but many of them are difficult to use and not entirely practical. For us, the most practical tool that we have come across is 3M Micropore Tape, and preferably the brownish colored one. This tape has excellent adhesive properties. It is of the correct width to support a scar well. It does not stretch in any direction, and with the surface being like paper, it can even be colored or have makeup applied in order to match different skin colors. It lasts well even when bathing or showering or swimming. So there are many aspects of this particular tape that make it ideal for our purposes. In this particular case, we decided to start over with respect to the scar. We excised the scar and brought the wound edges together with buried dissolving sutures. We supported the surface of the skin by means of 3M Micropore Tape. We continued to keep the scar supported by the tape. We counted the days from the heart surgery to the day of scar revision, and after exactly the same number of days, we re-evaluated the scar. Our photographs are shown at the same scale. This is confirmed by the mole near the upper end of the scar. The difference speaks for itself. Every one of our surgical patients is taught how to use this simple method, and every one of them is then assisted in maintaining the management as required in each individual case. In this case, we used Z-plasties followed by 5 months of taping. Here, we used taping for 4 months, followed by fractionated laser blending and a further 3 months of taping. This breast scar had remained immature for 8 years. After 4 months of taping, it had begun to mature. This keloid scar on the chin had previously been removed elsewhere 3 times. It regrew within a few months each time, and after excision and taping, it had not recurred even after 1.5 years. We respectfully acknowledge that there are some groups of people who use scarring as a form of decoration. Sometimes these decorations have religious and status-related connotations. We do, however, believe that most people who scar accidentally or as a result of surgery would like their scars to be as unobtrusive as possible. We start off by remembering our little mantra. If we support the scar does not need to support itself. We place a piece of micropore tape over the scar so that the scar is in the middle of the tape. If the scar is curved, then you use shorter pieces so that you can follow the curve. Don't pull on the tape, simply put it down like you would a postage stamp. Make sure that the scar is in the middle of the tape. After the tape has been placed, all you do is sit still for 2 hours. We suggest that maybe you read a book or watch TV, but you don't want to move the area around too much because that will loosen the plaster. After 2 hours, it's best to take a wet face cloth and place it over the tape and allow the tape to get thoroughly moist and then dry again. After this,
the tape will be stuck very securely. The tape will then stick for many days, regardless of whether you've been working, whether you've showered, whether you've swum. The tape will continue to stick. When it starts to come loose, that's when you replace it. All you do is take it off and put new tape. Notice that the tape often sticks better and looks better when it has got rough edges rather than square cut edges. The key is to support the scar until it has matured, and remember that scar that's mature is pale and flat, and a well supported scar will mature in 4 to 8 months. Here are the simple rules. Stop taping your scar as soon as possible. Keep changing the tape when it's loose. Wait at least 3 to 5 months before even starting to check whether you can stop taping. Check the color of the scar. If the scar is still pink, tape it wherever it is pink. Don't ever change the tape when it is well stuck, even if it is 4 weeks old. Keep checking the color of the scar whenever you change the tape, and if the scar goes pale, then it means that you can stop taping in that particular area. Continue to tape all the pink areas until the whole scar has gone pale. When you are dealing with curved surfaces such as you have on noses or ears, it is best to cut little cuts into the edge of the tape in order to allow the tape to conform to this curved surface. That way you will get better stability of your scar. Bear in mind that by supporting parts of your body, such as the wearing of a well-fitting bra, you can provide even further support for your scars and therefore expect even better results. Lastly, it is very important to store your tape with a flipped over end, otherwise you will spend more time looking for the end than you will taping your scar. That is all that you need to know about looking after your scars in the best possible way so that you can get the best possible scars after any injury or operation.